All right, guys, I have one more video for you today, and if anybody has ever eaten a meal with me, you know why I'm sharing this video. So my jaw clicks. I am a family of jaw clickers. There's a lot of tension in these muscles. They're some of the strongest muscles in our bodies, and when we have this tension and over time, they can kind of create these grooves in the bones. I will never forget when I had a model done with my most recent dentist, who was amazing, when I saw the pattern both in my teeth and in the jaw bone. It's pretty incredible, but here's the really cool thing. I've been able to repair a lot of those issues, especially managing stress when I free up the muscles of my jaw. So there are 4 directions we're going to work with today, and I'm not going to be doing the movements. I'm just talking you through them, and I'm only going to show you one of each direction and let you play with it once you find it. So just remember, this is not a prescription. This is not in lieu of medical help or guidance. But this is something that can help you when you've got some soft tissue pain and you're trying to find ways to relieve tension. So here's the movements. Your lower jaw, it can go to one side and the other. It can move forward, it can move back, and you can open your jaw. The first movement I want you to do is just to open your jaw so it moves closer towards your chest. And as you do that, notice, does it come down straight? Is there a zig? How does that movement happen? Slowly allow your jaw to close. And we'll just go quickly through these movements today so you can come back to them and try them a few times on your own. The second movement is gliding your jaw to one side or the other. So your lower jaw moves parallel to the floor. Sometimes it helps if you think about letting your lower teeth stay gliding along the top teeth. So you slide, and same thing, does it go smooth or is there some bumpiness? Slowly bring your jaw back and pause. Go to your second side. See how that moves. Come back slowly. The other piece I want you to keep in mind as you go through these is if you do have a tendency for there to be a click or a noise, I want you to stay just on the inside of that place. So don't allow the noise to happen. You're working within a range of control that you can prevent with time. You'll be able to go a little bit bigger and not have that click happening. So we've got the jaw opens, the jaw moves to one side, it moves to the other. The next practice is like a cash register. You're gonna slide your jaw forward, your lower jaw glides forward, and then you release your jaw back in space. And the next one, sometimes this is tricky to find. So if you kind of follow your jaw to the back, you can hook 2 fingers on the back and just give yourself a little bit of forward press to see if you can find this tension. So you just kind of hook and pull forward slightly and glide your jaw back. Keep that pressure gentle. It's just to make sure that you can feel your jaws moving, and you slowly let that tension go. So again, you do each of these 2 to 5 times. You know, overkill doesn't really make it get better faster. It's more about the repetition and finding new, exciting ways to move with that pandiculation, creating the contraction, slowly releasing it, and that release on the way out, learning how to find that path even more slowly. That's when you create new synapses, you create ease in your movements, and things start to feel better. Let me know how this one goes.